If you've recently tried some antibiotics to help clear acne and unfortunately didn't get the results that you were hoping for, this video is going to be all about how antibiotics work, why we'd use them, and why they maybe didn't work for you and what you can do afterwards, because I want you to know that if the antibiotics haven't helped, there's a lot of different options that you've got to help clear your acne. So please don't lose hope. You can clear your skin, and I'm going to give you some tips on how to do it. I'm Amelia, I'm a nutritional therapist and skin specialist, and I specialize in acne. So this is something that I see a lot with clients that I work with one-to-one. So if you've gone to the doctors about your skin, usually the first line of treatment is some kind of antibiotic treatment. And you can get topical antibiotics and you can get oral antibiotics. So that means you'll either use them as a topical cream or you'll take an oral tablet of antibiotics, and a lot of the time you'll do a combination of both. And you'll usually be given this treatment for 1 to 3 months. Sometimes it'll be a little bit longer. You could even do 6 months of antibiotic treatment, and then depending on how effective it is, you'll either stop treatment, or if it's not being effective, you'll look at other options. So what tends to happen from a medical side is that you might look into hormonal contraception, or there's things like, are you able to try something like Roaccutane? So that would usually be the next phase of treatment. But I will also talk about other things that we can do to support the skin if you're not able to do those medications or you don't want to do those medications. Obviously, you always need to speak to your doctor before doing anything. But if you were to do anything from a nutritional or topical perspective, again, you want to talk to a nutritionist or a skin specialist. So if you did do antibiotics and the treatment didn't work as well as you hoped, let's talk through why that might happen. One of the most common underlying factors I see when I work with clients is that it's actually hormonal acne. And while you might get the benefits from an antibiotic to help reduce the acne causing bacteria and give you some anti-inflammatory benefits while you're on the treatment, the antibiotics don't do much to balance your hormones or support your hormones at all. So you might get the benefits while you're on the medication, and then of course if you've still got that underlying hormonal imbalance, you'll then lose the benefits of the antibiotics and you've still got this hormonal issue which is contributing to your skin condition. Sometimes you may already have a diagnosis of something like polycystic ovarian syndrome, PCOS or PCOS, lots of different ways that people name that condition or pronounce it. If you do have a diagnosis of something like PCOS, you may already know that you have higher levels of testosterone, and the way that you're going to support your skin is actually by supporting your hormones, because the skin issue is coming from a hormonal imbalance. But you can still have hormonal acne and not have a condition like PCOS. But if we were to zoom in on the hormone that tends to be the main issue when it comes to acne, it is testosterone, but also other androgens like DHT, and DHT is more potent than testosterone. So sometimes you may have tested your testosterone levels and testosterone looks normal, or it might even be low, but what's not commonly tested is DHT, and that is 3 to 5 times more potent than testosterone. So you could have normal or low levels of testosterone, but unknowingly high levels of DHT. Both testosterone and DHT can increase oil production in the skin, which then affects the bacteria levels on the skin, so it can feed that acne-causing bacteria, and then that's going to increase the risk of breakouts. Now, you don't just want to think, okay, I've got high levels of testosterone, let's focus on reducing the testosterone. You actually want to think what could be causing or contributing to that hormonal imbalance. And there's actually a lot of underlying drivers which then affect hormones. So blood glucose control and balancing insulin is actually really important, because higher levels of insulin can then impact testosterone and DHT, which then impacts the skin. So actually, to support your hormones, it might be that you want to investigate, is there actually a blood glucose issue? And if you are diagnosed with PCOS, it's very common for women with PCOS to have issues with insulin and blood glucose control. So regulating that should then have a knock-on effect on the testosterone and help to increase something like sex hormone binding globulin and decrease hormones like testosterone, which will then have a knock-on effect on your skin. So first reason why your acne might have come back after antibiotics could be that it's hormonal, but there's other things that you can do to help to support your hormones. Second underlying issue that could be happening if your acne's come back after a round of antibiotics is that maybe there's actually something happening in your gut, and the gut microbiome is really important, not just for skin health, but it also impacts your immune system, which is going to then affect how well your skin heals and the inflammation in the skin. It does also impact our hormones. So again, going back to if you've got a hormone issue, you want to make sure that your gut microbiome and your gut is functioning well, because it has a knock-on effect on your hormones. So when we use antibiotics for long periods of time, or if we've had multiple rounds of antibiotics, so it might be that not even just for your skin, but maybe when you were younger, you had infections. So it could be like ear infections, tonsillitis, UTIs, so a urine infection. And that may have disrupted the gut microbiome, which is then having an effect on your skin. And yes, you might get the benefits from the antibiotics while you're on them, but then if the microbiome is still off balance, it could come back after you've finished that treatment. Another thing that can happen with the gut microbiome if you've had a lot of antibiotics is sometimes it can increase the risk of a fungal infection or a fungal overgrowth. So it might not be that it's actually just a bacterial issue. You could actually have a fungal issue as well. And that can happen in the gut, it can happen on the skin. Some people can be more prone to thrush after antibiotics. So those are some signs that maybe there is an issue with a fungal overgrowth. And thirdly, another driver that can affect the skin is actually nutrient deficiencies. And it's really common for me to see nutrient deficiencies in clinic, even in those people who are eating a very healthy diet, and you wouldn't expect them to have any nutrient deficiencies. If something's happened to the gut or the gut microbiome, it can have a knock-on effect on nutrient levels, and sometimes certain medications can impact how well we absorb certain nutrients. So you'd want to make sure that you have ruled out nutrient deficiencies, because an antibiotic isn't going to correct low levels of vitamin D, which might be affecting your skin. And I'm not in any way saying that the reason that you have acne is because you're vitamin D deficient. It's just a combination of a few nutrient deficiencies affects how our immune system works, how well our skin heals, how well our hormones are created and cleared out. So we want to make sure that we've got good levels of nutrients, and I tend to do this in clinic by testing them in a blood test. So you can have a look at vitamin D, you can have a look at iron, you can have a look at B vitamins, you can have a look at magnesium, you can have a look at omega-3, and make sure that you've got good levels of these nutrients to support your skin, because like I said, the antibiotics aren't going to correct a nutrient deficiency. And the final thing that can be affecting your skin is actually that we might have damaged the skin barrier. And if the skin barrier is damaged, it is going to struggle to heal. And actually a damaged skin barrier can increase the risk of breakouts and inflammation in the skin. Now, why would your skin barrier have become damaged? Well, it can be a combination of reasons. A very common thing is to use the wrong skincare, or if you've had a lot of quite harsh skin treatments, which is common for acne. So there's a lot of peels that are recommended, there's a lot of acids that are recommended, the antibiotic treatment, the foaming cleansers or oil kind of stripping routine, that can all damage the skin barrier. And it doesn't really matter how healthy you eat or how many supplements you take or whatever else you're kind of doing to support your skin. Even if the skincare feels like it's good and it's good for acne, if it's not right for your skin and it's actually doing more damage, you're not going to heal your acne, unfortunately. And although I've spoken about the gut microbiome, it's not very common for us to speak about the skin microbiome. And again, just like the gut microbiome, if you keep using antibiotic treatments on the skin, it can start to affect the skin microbiome. It can start to affect the acid mantle, which helps to keep the skin at the right pH so that we can increase the growth of beneficial bacteria on the skin, which helps to maintain skin health. So by using the wrong skincare, you could be affecting a few areas of the skin's function, which then increases the risk of skin conditions or breakouts, and also slows down how well the skin heals. So the final thing is to just make sure that your skincare routine is correct for your skin. I personally really like a brand called Dermavisuals, and you will need to work with a practitioner to access those products, but they're all about repairing the skin barrier, and it might be a little bit of a slower journey for some people compared to the harsher skincare products. But once you have repaired the skin barrier, the skin kind of looks after itself, and you'll feel that it is so much healthier. So that is a really important factor too. Now, if you are using antibiotics to support your healing journey, I wanted to talk through what you can actually do from a food side to support your skin as much as possible. Now, when you're on antibiotics, if you were a client, I do sometimes recommend probiotics alongside the antibiotic treatment, because this may help to just protect and support the gut microbiome. And there's 3 different types of bacteria blends and strains that I will use in clinic. First one is Saccharomyces boulardii or boulardii, and that is a probiotic yeast which has been shown to help reduce some of the side effects of antibiotics. So if you end up with diarrhea after antibiotics, Saccharomyces can be good to reduce that risk. It's also quite good at reducing the risk of a fungal infection. So if you are prone to something like thrush with antibiotics, sometimes Saccharomyces boulardii could help to reduce the risk. Lactobacillus rhamnosus GG is another strain that can be useful while you're on antibiotics. And then the Lab 4 blend of bacteria also has research to show that it supports the microbiome when people are on antibiotics. So you wouldn't need to do all 3. I would just select one for a client depending on their health history, what type of antibiotics they're using, how long they're doing the antibiotic treatment for, etc. So that's one area that you can try, but I would always recommend before you use any form of supplements that you double check with your doctor or some kind of medical professional who can just make sure that what you're doing is actually safe and useful for you. Now, I know I spoke about probiotics first, but actually I would always recommend food first. So you want to make sure that you're eating in a way that's going to support your microbiome while you're on antibiotics, and also after you finish the antibiotic treatment as well. So the first thing is to make sure that you're getting a diverse diet, and you're going to do this by eating lots of different fruits, vegetables, nuts, seeds, and getting lots of different colours in. So something that I tend to recommend for clients, because sometimes it can be a little bit easier, is actually focusing on mixed bags of fruits or vegetables or even grains. So you can get mixed bags of grains, and it might have quinoa in there, rice in there, and other grains that you can have together, and they come in a pre-cooked pack, so you can just add it to your lunch and you'll get 3 different grains which all actually support diversity. So even if they come under the same category, like they're all a grain, they'll have slightly different levels of fiber, slightly different antioxidants, slightly different polyphenols, and that's all going to support your gut microbiome and help to grow different strains of bacteria. Mixed bags of veg can be useful. So frozen veg is still great. Veg can be frozen as soon as it's picked, and that helps to maintain its nutrient content. Frozen berries, instead of just putting like blueberries in a smoothie, you could get a mixed bag of frozen fruit. So it could be that you've actually got mixed berries. So you've got blackberries, raspberries, and blueberries all in this one mix. So you'll put that into your smoothie, and instead of just having 1 berry, you've got 3, which is incredible for skin health, and they're also really high in antioxidants and low in sugar. Other things that can be useful for people is to actually focus on color. So again, you might not need to change too much of what you're eating. You just want to get a variety of color in, and you can do this by actually eating the same vegetables. So yes, ideally we'd want to get lots of different fruits and vegetables in, but for example, you could have red cabbage and white cabbage in your salad instead of just white cabbage alone. You could have a red onion and a white onion. They've got different colors, which will mean different polyphenols and different antioxidants, which again feed different bacteria. You can get red grapes and green grapes. You can get red apples and green apples. You can get black olives and green olives. So there's a lot of different colors. I mean, peppers come in green, orange, yellow, and red. Tomatoes do as well. So you can still eat the same food, but actually get slightly different antioxidant levels, which will give you a benefit from a gut side. So focus on color, focus on diversity. And then from a fiber side, we're actually trying to hit 30 grams of fiber per day. Now, it's a little bit more difficult because fiber-rich foods don't really have food labels on them, so you wouldn't see exactly how much fiber is in there. But things like legumes, so beans, chickpeas, lentils, are very high in fiber. And actually just adding some of those to your meals really boosts the fiber content and make it easier for you to hit that goal. Something else that can be useful is you could play around with probiotic foods. So these are fermented foods, and the fermentation process actually increases levels of live bacteria, and that's very beneficial for our gut microbiome. So this is things like kimchi, kombucha, kefir, and sauerkraut. There's other things that you can pickle and ferment too, and you'll get benefits from there. But again, you can aim to get it in your diet on a weekly basis to start with. And then if you want to make your own and you've got loads of fermented foods on hand, you can eat them on a daily basis. And it's just helping to give you some live bacteria to support your gut microbiome. Now, if you have noticed that your acne has come back after antibiotics and you're wondering what you can do next, if you were a client, this is what I would recommend to do. So first, we want to investigate that there's not an underlying imbalance. So we could look into your hormone levels, we could look into your gut health, we could do a blood test to check for nutrient deficiencies, and then we want to use food and supplements to correct the imbalances that we found, and that should then have a knock-on effect on your skin and help your skin heal. And we also want to be thinking about a personalized skincare routine to then help your skin heal. So if there is that you've used quite a lot of stripping and harsh products, or maybe you've put too many actives into your routine at once, because that can stress the skin out too. You've put in actives that your skin actually wasn't ready for, even if they're meant to be beneficial. We want to just strip that down to a simple routine, make sure that you've got in things that are supporting the skin and helping it heal. So if it is something you wanted more personalized support with, it's something that I do in my one-to-one sessions in clinic. I am based in the UK, but I do work with clients internationally. So if that is something you wanted to do, I've linked the information in the description box below. And if you enjoyed this video, give it a thumbs up. If you've got any questions, ask them in the comments. And if you've got anything else that you'd want me to talk about, obviously leave that in the comments too, because I'll be creating lots of videos around skin health.